Muscle loss with age is a universal challenge, but the way it unfolds and how best to counter it differs significantly between men and women. These differences are rooted in biology, especially in how hormones like testosterone and estrogen shape the body's ability to build, maintain, and repair muscle. As men and women move through midlife and beyond, understanding these hormonal shifts becomes crucial for creating more effective, personalized approaches to resistance training, recovery, and nutrition. Rather than adopting a one-size-fits-all program, acknowledging gender-specific physiology can enhance both results and long-term health. For men, the primary hormone driving muscle mass and strength is testosterone. Testosterone levels naturally begin to decline after about age 30, and the drop becomes more pronounced by the 50s and 60s. This gradual reduction, sometimes referred to as andropause, contributes to the loss of muscle size, atrophy, slower recovery from workouts, and increased fat accumulation. Men may also notice a decrease in workout motivation or energy levels, as testosterone plays a role in both physical drive and emotional resilience. However, the silver lining is that older men still retain a relatively strong anabolic potential compared to women, especially when resistance training is applied consistently and progressively. Heavy lifting, using lower reps and higher loads, is particularly effective for stimulating testosterone release and promoting muscle maintenance in aging males. When combined with adequate dietary protein and sufficient sleep, men can often preserve or even regain substantial strength and lean mass well into their later years. That said, training volume and recovery periods may need adjustment as testosterone drops to account for slower repair and increased injury risk. In women, the story is more abrupt and complex due to the hormonal shifts that accompany menopause. Estrogen, which supports not only reproductive function but also muscle mass, bone density, and metabolic regulation, drops sharply during this transition, usually between ages 45 and 55. This decline contributes to a range of physical changes: accelerated muscle loss, reduced strength, joint stiffness, and a tendency toward fat gain around the abdomen. Importantly, estrogen also plays a role in satellite cell activation, the process by which muscle tissue repairs and grows. As estrogen wanes, this regenerative process becomes less efficient, making muscle maintenance more challenging. Still, the body remains highly responsive to strength training even after menopause. In fact, research shows that resistance training is one of the most effective interventions to counteract postmenopausal muscle loss, particularly when combined with adequate protein and possibly creatine supplementation. For women, strength training protocols often benefit from slightly higher reps, moderate loads, and an emphasis on total training volume. Mobility work, balance training, and joint-friendly movement patterns also become more important due to changes in connective tissue elasticity and inflammation levels that may increase with estrogen loss. While both men and women benefit from resistance training, recovery strategies may differ. Men typically require more focus on joint protection and managing training intensity to avoid overuse, especially with heavy lifting. Women, meanwhile, may benefit from more structured recovery and attention to inflammation, bone support, and sleep hygiene to buffer the effects of hormonal flux. Sleep, in particular, plays a huge role in muscle repair and hormonal regulation, and it's often disrupted during midlife, especially for women during perimenopause and menopause. Prioritizing deep, restorative rest helps maximize the benefits of training in both sexes. Another key consideration is that muscle loss doesn't occur in isolation. It affects every aspect of health, from metabolism to mental function to cardiovascular stability. Tailoring training and nutrition to the specific hormonal realities of men and women isn't about reinforcing gender differences. It's about empowering individuals with better tools to preserve strength, independence, and resilience as they age. Ultimately, aging doesn't strip away the ability to build muscle. It just makes the process more nuanced. For men, working with the reality of falling testosterone means adjusting volume and intensity while maintaining challenging workouts. For women, countering the effects of estrogen loss involves higher training consistency and attention to joint-friendly movements and recovery. In both cases, personalized strategies lead to better results, fewer injuries, and a stronger body that can age actively, not passively. Recognizing these gendered patterns of muscle decline isn't limiting, it's liberating, because it offers a more precise and effective path forward for lifelong strength.